Our heart is but a reflection of the great design that echoes within and all around us, Earth's mighty song. From the ocean currents to the mountains, we all add this intricate orchestration of life. In today's episode, we explore the mechanics and constructs of that rhythm, the heart. But first, we begin with a special presentation by Soca superstars Fay-Ann Lyons and Bunji Garlin, hyped fitness bootcamp that brings together carnival, culture and community through fetes and fitness.
Something that I want to tell you, in a while on the mind. We sharing this road together, the stage not too far behind. This one goes out to every fetter to discuss your behavior. When you reach the road, get on like you catch a zombie. Hot fantasy mode, jump up cause it's... I am a Caribbean woman at heart, 100%. I love Caribbean food. I love Caribbean culture. I love everything about our Caribbeanness. As somebody who's been in the party circuit for many, many years, I've seen the benefits of partying from an aerobic standpoint, from an exercise standpoint. So you burn a lot of calories with the level and the intensity of our music. We use culture, we use music, we use moves that's synonymous to Trinidad and Tobago, the jump and wave, the running, the hip movements, the gyration, and we make people enjoy exercising. So a lot of the times it takes on a kind of party-like atmosphere. So anybody who's been there, know we're very inclusive. We don't leave you behind and you say, well, okay, I'm not as fit as the other people. There's none of that. The benefits of exercising and coming out here with the people and just being among the people and listening to people's stories of recovery and stuff like that, that actually helps my mental health as well, because it gives you a nice notion that, you're doing something that's affecting people, even though you don't see it on the surface level. We have older people that come out, they don't really do too much of the exercises, but they're there. And for 3 hours, you give them companionship. They come, they sit with their chairs, and they're there, they're smiling. Some of them videotaping, they might see an old friend. So it's much more than just being in the exercise. It's about being a community of people that's benefiting from one common goal, which is exercise and music and culture.
We're ready, we're ready, yeah, we're ready, 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 ready.
It's something that is in us as a people. Sound, music on a whole, is very intricate to Caribbean people. If something is difficult, put on music next to what a Caribbean person is doing, and it becomes 10 times easier. Faye is really the fit person. And I think she have found a way to tap in and understand how to get both sides to work, because naturally on the road in Trinidad and Carnival, when you're moving that whole, you're walking all them the whole day behind the truck, all that is calories burning, his miles, his footsteps counting, so it's a natural fit. It was like that Wednesday afternoon, and Faye was like, I want to do a pump, like a party, like part exercise, part entertainment, and I want to do it Saturday. I was like, which Saturday? This Saturday, yeah. Like, what? I had to think, but we had to get truck, we had to get permits for the truck, and Faye was like, whatever we have to do it, but we have to do it Saturday because people need it. And she was right about it. You see that sense of jubilation and freedom and relief and like, oh gosh, I needed this. They get a chance to release.
Stress relief.
Yeah. They get a chance to burn out some, It's something, and it's been amazing ever since. And the team riding with her 100%.
When we say be proud of your culture, this is one of the aspects of why you should be proud that your culture, not just an advertisement on ID card, is actually a mechanism, a tool that you could use to better yourself as a person, as a family. Because here, you're not just getting fit. If you bring your wife and you bring your kids, you're getting fit as a family. If you bring your wife and you bring your kids, you're introducing your younger children to culture, to music, to the artists. And they're putting their hands up in unison, they're exercising in unison. And when they're done, we do a little treat where we do a little performance for them. Everybody parties and, they jump and they wave and they get a little carnival. Because there's also people who, they don't go to the fetes. This, for them, is a substitution. So we give you a little bit of what we do on a nightly basis. After you've exercised, we introduce you to some of the artists. So you get to see some of your favorite stars in a fitness event, come and perform, and you don't even have to buy a ticket.
Hi, my name is Fay-Ann Lyons.
This is Bunji Garlin.
And we just want to encourage the entire Caribbean to stay fit.
Your culture is a beautiful thing. Find ways to use your culture. Use whatever you have in your house, in your home, as a family. Do it. You can do it. Just move. Just remember, moderation, but consistent moderation is the key. You're watching Caribbean Medical TV. Stay tuned. Keep it locked.
Check.
Jump with us. Let's go.
Now we
meeting again.
Thank you, Fay-Ann and Bunji, for this immense contribution of bringing awareness to health and wellness. This is the Cardiology and Dental Health episode.
So let's talk a little bit about the health economics. This is a very specialized field, and we have experts who are examining this, people who have gotten PhDs and master's degrees in that particular area of healthcare that are essential in planning for the health of the population. We in Guyana have had to allocate a significant portion of our budget to healthcare. Now, that is from a national or more a governmental side consideration. But if you imagine that the greatest population who get heart attacks, for example, are people in their 40s and 50s. Now, who are these people? People in their 40s and 50s, they have young children, they have teenagers going to school. These are people who have dependents in their productive years. So when you lose that family member to a heart attack, not necessarily dying from a heart attack, but their effort tolerance, how much work they can do, and therefore how much income they can generate. When that is affected, then the entire family, the entire village, the entire town is affected one way or the other. So it's a very critical thing for us to address, the implications of the health scenario on our budget, our economies, and our financial status.
The other thing is the availability of treatment. Oh, there's a lot of new treatment for heart disease. New drugs are coming out, new modalities of treatment. But the problem that comes up is whereas there's a demand for it because our people see it, we can't afford it. One author referred to a side effect. They speak of side effects of the drug, toxicity of the drugs. And this author interestingly said we haven't discussed the financial toxicity of new medical care. Are people going to be able to afford it, or are they going to die because they can't afford it? So those are new aspects, I think, of heart disease that we're all going to have to consider. The people who wish to rule us and who wish to decide where they go in terms of provision of medical care will now have to take these aspects into consideration.
I think here we have to encourage well visits. So even before you start having symptoms, and warning symptoms would be things like chest pain, shortness of breath, racing of the heart, fainting spells, those would be things that would definitely be red flags. But even before the appearance of those, I think that it's important to actually go in to get checked up. Regular visits to be able to check your blood pressure, for example. Because things like hypertension or high cholesterol, for the most part, are asymptomatic. And you only become symptomatic when sufficient damage has been done for your organs to start showing some form of impairment. So I think early detection is key, and probably from the age of 35 or 40, everyone should ensure that they go in possibly for yearly visits to their family physician to be seen for regular screening. And as we mentioned, the symptoms to look out for: chest pain, shortness of breath, recurrent fainting, because people do faint, and sometimes not for heart reasons.
High blood pressure can cause the heart to fail, because many years of high blood pressure that is not well controlled, it means this pump is squeezing against high pressures for several years. The heart is very adaptive, and for many years it's going to adapt, and it is going to come up with ways to cope and compensate. And it gets to a point where it cannot do it anymore. And usually that's when we now have to get involved. When they present with this complication, it makes it more difficult for us to treat at that point. And then maybe at that point they may think, but why aren't they helping us? But you have presented very late. All right, we would like to treat you before we get to that point.
So when I got the pain, I was at home
on my bed with my kids, having a normal afternoon, when the pain came on abruptly. But like I said, it lasted for 25 minutes, so I knew to myself something was wrong. When it started radiating down my left arm, so I did call my family because I knew to myself it was an emergency. The emergency services, they responded very quickly. From the onset of responding to me, as they picked me up, they themselves realized it was either a heart attack or a stroke. And by the goodness of the attendants, as we arrived at the emergency room, I did an ECG and the SC elevations did show it was a massive heart attack at that time. After that, I learned about the percentage of my heart function, which was 40%. But again, after your discharge, you still have a follow-up review. And again, thankfully, being educated by the several cardiologists I've seen, I was able to reverse my ejection fraction. And now I'm back at a normal heart range.
Thank you, Anesha, for sharing your perspective. We applaud your strength on the way forward. And for the benefit of further understanding, we'll listen to Dr. Risshi Rampersad of Trinidad and Tobago and Dr. Mahendra Carpen of Guyana as they explain exactly what a cardiologist is.
A cardiologist is someone that takes care of the diseases of the heart in patients. But an interventional cardiologist is a person that intervenes into the heart, where we may take catheters and wires and go through the hands or legs and get into the heart to look at the coronary arteries to diagnose and treat if there are coronary artery disease or if there are blockages in the coronary arteries. We can also even go in and fix these blockages and narrowings in the coronary arteries to help our patients. But interventional cardiology has grown into being able to go inside and change heart valves. We can actually go inside and look at the electricals of the heart, and we can also go inside and put pacemakers inside of the heart. So there are many different facets of interventional cardiology.
The interventional cardiologist fixes blockages in the arteries of the heart and does invasive procedures. The electrophysiology part is essentially a cardiac electrician. That is the rhythm center of the heart. The heart's rhythm, the way it beats, the way it functions, is highly dependent on electrical activities generated by the cells of the heart. And so an electrophysiologist is someone who specializes in that system of the heart.
Hello, I am Nigel Batiste, Group President and Chief Executive Officer of Republic Financial Holdings Limited. The Republic Group has always prioritized the holistic development of the communities and countries we serve. It's a mission driven by our flagship Power to Make a Difference corporate social responsibility program and the dedication of our staff, where we focus on 4 key pillars: the power to learn, the power to care, the power to help, and the power to succeed. For us, this is just the beginning of our sustainability journey, and we remain fully committed to unlocking financing to support the attainment of the United Nations Sustainable Development Goals, which ultimately would lead to a Caribbean region that is safe, healthy, and sustainable for many generations to come.
I am Navid Dukran, CEO of EximBank, and we understand the power, impact, and transformative potential each citizen has. Our vision is to transform the domestic export environment and be the preferred trade finance service provider, creating value and making a difference in our national economy. Here at EximBank, we recognize that we operate within a complex rhythm that exists in our social structures and biodiversity. It is written in every community and generation. So let us work together to facilitate growth and expansion, creating sustainable employment while respecting our planet and our environment. Our nation's strength lies in the people and the generations to come from the work we do today. The journey is before us and the challenge is here. The need is now. We are but a reflection of the world we live in. So let's work together to make it a better, healthier, and more sustainable one.
Welcome back to Caribbean Medical TV. Today, we explore the intricacies of the heart and the internal and external aggressors that can contribute to possible risk factors.
Stress can increase your risk of having things like strokes and heart attacks because sometimes it sends up your blood pressure, sometimes we think that it causes other stress hormones to be released that can increase your risk of having one of these events. But it also has an impact in how you look after yourself. Because people who are anxious or depressed, they tend not to want to do anything, which includes taking your medication, which can include going to see your doctor to know what's happening, and then exercise. Most people, when they become depressed, they don't feel to do anything, so they're not going to go to take their walk.
When we think of cardiovascular diseases, and really when we think of obesity, it is directly related to a cardiovascular disease. And again, if we can just break it down, cardiovascular refers to, cardio means the heart, and vascular refers to the blood vessels. So when we talk about cardiovascular disease, we're referring to diseases or conditions that affect the heart and or the blood vessels. Now, these conditions we can also divide into two. Those that are congenital, meaning that we were born with it, and those that were acquired, meaning that throughout our lifetime we developed it. And this is where we want to focus on the acquired conditions, because we can now assess risk. And most of our daily function is about risk stratification, because we try to assess risk, see who is highest at risk, and therefore would require pharmacological treatment to prevent a severe cardiovascular event. And when we say cardiovascular event, we're talking about something severe as a heart attack or stroke.
One of the infectious causes of heart disease that we didn't look at because we were so preoccupied with rheumatic fever affecting the valve is what the dentists are telling us to look at: periodontal disease. Disease of the gum can actually cause disease of the valves of the heart. Not only the valves, but the muscles too. So a part of a thorough cardiac assessment in this age is a referral to your dentist, for the dentist to make sure that you do not have subterranean periodontal disease. Just like the bacterial infection of rheumatic fever that we used to go to the tonsils, the bacterial infection of the gums can also get into the bloodstream and affect the heart. So we now need to look at things that are markers, little flashing lights that say heart disease, careful around that bend, heart disease, careful down the road. So we look at things like diet, we look at things like exercise. Now we realize, we looked at the older things like smoking. So what are new things that we were missing? And one of the things we realized that we were missing was the association and the connection between the dentist and the cardiologist. So that must be an important consideration in terms of your total health aspect. Not only your blood pressure, not only your diabetes, but your dental health.
We have evidence now for quite some time about the relationship between gum disease and heart disease, and also gum disease and diabetes. With respect to the heart disease, there are a couple of factors. We talked about the fact that we get inflammation because of the buildup between the gum and our teeth. And as I said before, the blood that flows within our mouth is the same blood that flows within our heart. The bacteria cause different cytokines and enzymes to be raised in our blood. And what the research is saying is that those same cytokines that are caused to be higher by the gum disease have a negative effect on our heart health. We therefore understand that if it is you have gum disease, you are at greater risk of actually developing heart disease. And therefore, we also want to make sure that you're watching your heart health and consulting with your physicians, because unfortunately that relationship is there. What we also know is that some of the bacteria seem to be associated with the formation of the atherosclerosis plaques in the heart. So therefore, we talk about people having to have bypass surgery, and that's because they've developed problems with their blood vessels to their heart. Well, it seems as if some of the bacteria from the mouth may play a role in those plaques being formed as well. So again, we want to try to make sure that we're looking after our oral health, because that can really affect our heart health as well.
It has become clear that dental health plays a critical factor in our overall health, not just for the heart, but other non-communicable diseases.
With respect to the diabetes, what we actually know is that there's a bi-directional relationship between gum disease and diabetes. We found out that diabetes, if you are diabetic, you will have a greater chance of having gum disease. But we've also found out the other, that if you have gum disease, you have a greater chance of developing diabetes over time. What I can also say is that for quite some time now, we know that if your blood sugar is high and you have active gum disease, when we treat that gum disease and we reduce the inflammation, things actually improve. We are fortunate in this time to have quite a large number of regionally trained dentists who are able to help you. We are able to look at your teeth, examine them, and guide you. There are a lot of dental and oral diseases that will have no pain but can become quite severe. We want to prevent you from losing your teeth. We want you to keep your gums and teeth healthy.
Thank you, Dr. Myers, for sharing your insights. Be sure to subscribe to our YouTube channel for more episodes and behind-the-scenes discussions.
We spoke about other little factors that contribute to heart disease, factors that we didn't think of before. Quite a while ago, the Germans realized that, or at least one set of German scientists realized that the further you live from the Autobahn, the lower the incidence of heart disease. And somebody said something has to be associated there. And they worked from that to the fact that it is the carbon pollution in the atmosphere. And then the Irish noticed that as their economy declined and factories shut and factories moved out of area, the general health of the impoverished population increased or improved. So you started to notice that observation, that association. And then it started to work down to what we call a micro level. So you're close to the Autobahn, it must be motor vehicle pollution. That's the only thing. It's not just the tar on the road. What it is about the pollution. And then you realize that the fine carbon particles get into the bloodstream, get into the lungs, and stimulate the underlying cause of all of this. They stimulate a negative inflammatory response. And that is what drives everything. You know, you can have heart disease with cholesterol and no problems clinically. But if you have heart disease with high cholesterol and then you add an inflammatory situation to that, that's when it explodes as a heart attack. You add the inflammatory situation of acute COVID, and people with underlying heart disease that didn't even know they had heart disease then present with their heart attacks. So that is how it happens. At the gross level is the pollution, is those particles that get into the bloodstream.
So the question may be, how long can our heart adapt to being overweight or all of the other aggressors that we subject it to? And the answer is it's quite varied from person to person, just because it is multifactorial. Every individual is different. As we said, 90% of cardiovascular diseases are preventable.
Well, that's a good place to start. The paradigm that we have is a paradigm of heart disease occurring when you're old. But now you see so many young people dying of heart disease. Several causes for this. If you take the young athlete, that is one thing that we're seeing. You're seeing it in the Premier League, you're seeing it in La Liga, you're seeing it in the Olympics, in which these young athletes just drop dead. There's several reasons for that. One may very well be over-exhaustion. That is a fact. The other is genetic heart disease that we never looked for in the past because it didn't matter. In the past, we were dying from infectious heart disease. We were dying from disease of diet. Now you've sorted that out. The genetic causes of heart disease are now coming to the fore. Most of the genetic causes manifest themselves as abnormalities of the electrical function of the heart. So they develop these things called arrhythmias, which is an abnormal rhythm of the heart, and that can lead to sudden death on exertion. So that's one of the things.
It is extremely important getting the athletes, so just young people, or everybody on a whole, just to get screened at some point in your life to establish what is your baseline. And from that, we can now determine what frequency of follow-ups that you require, because we now have an idea of your baseline of health. Previously, I would say we were less vigilant with the athletes because they were young and strong and they seemed apparently healthy. But more recently, I have had to see a lot of athletes prior to tournaments. They are all screened very carefully in terms of their functional capacity with EKGs. When they're under competition, extreme sports, then they can suffer heart attacks at that time because they push themselves very hard, of course. And whereas it might not affect the ordinary person who is not into competitive sports, the athletes, that person might feel the effects on the field. So I would like to let everyone in Dominica and the rest of the Eastern Caribbean and the Caribbean on a whole, I would like them to know that a lot of advances have been made in cardiology, and the only way we can take or have the advantage of these advances is by visiting your healthcare provider. If you go into the doctor just for your annual checkup, we will be able to screen you for certain diseases. And the idea here is to discover the risk or prevent it from even beginning.
One of the key things I would admit to you, in the beginning, when you have a heart attack, you think there's no hope because a doctor comes and says heart failure. So you're going to say, whoa, I only have a couple months to live, a couple years. That did go through my mind. But you have to find it within yourself to speak to God. Believe in something higher, whether it's Allah, Jesus, Buddha, whoever. There's something higher. And that holistic approach gives you some calm. It gives you some calm. And I would tell anybody, whether it's a woman or a man, I've spoken to several people and it took me a while to understand that holistic concept. Otherwise today, I would still be worrying, am I going to die tomorrow morning? Am I going to die if I just feel an ache in my knee or my finger or my back? So I have to admit, I probably would have experienced a little psychological aspect of fear that I would have died, but you can't live that way. You have to be hopeful once you're doing the right thing. You can live a long way.
An insightful and inspirational perspective to live by. Thank you, Anesha, for sharing your experiences with the entire Caribbean. We hope you enjoyed today's program, and we look forward to seeing you on the next episode of Caribbean Medical TV.